I noticed like there was an abnormality in my posture and the way my abdominal area looked. Like one side was curved and the other side was straight. And I just kind of shrugged it off for a long time, just think, oh, I'm just built differently. I'm just weird like that. But I would go to school and sometimes get those like reports that I have bad posture, but still would just shrug it off. I didn't realize I had like a medical condition called, I didn't know it was scoliosis. It wasn't until maybe like the age of 16 or 17, I learned what scoliosis was, and I was like, oh, I definitely have that. It wasn't until this year, the beginning of this year, 2020, in like February, I just started looking more into it, going on YouTube, looking at other people's stories, and it was actually a YouTube video. Somebody in the comments recommended Scoliosis Reduction Center. And yeah, I went on the website and I was just immediately blown away by, you know, the treatment approach is alternative medicine. It's non-invasive treatment, so they're not cutting you open or anything, which was nice. And then the results was what really hooked me in, because I was like, wow, like when I went to the results page and saw like the dramatic transformations that this clinic was able to achieve without surgery, I was like, this is exactly what I want to do.
With the amazing results that we receive in intensive care, to let all those results go away would be obviously, it wouldn't be the end of the world. Obviously, we could reduce it again because we know the patient responded one time. But the idea is not that. The idea is to sustain and hold as much of that reduction as possible. So what makes our care unique also is that since we're applying the treatment in the clinic, we're also designing their home care and home rehab based upon the results that actually happen. So we already know what's going to work or what doesn't work. So we take what we've learned from the office care and we apply as much as we can to a specific home rehabilitation program. These are not general exercises like, strengthening exercises for your biceps or your shoulders. These are scoliosis-specific exercises. They call them SSEs. In order for an exercise or home therapy to be effective, it needs to be scoliosis-specific for that scoliosis patient or that curve type. So we designed that entire program to make sure that they're doing that properly. And with addition, if the patient has a brace, like Amber does, we also are their orthotist. We designed the brace to match the therapy and the home care as well. So everything is very coordinated.
Moving forward, I understand now that to see continuous progress, it's really in my hands now, and it's dependent on how much I want it at this point, because yes, Dr. Tony and everyone, they have helped me to get good results. So I have to be determined and consistent. It is a lot. It's definitely a lot, the exercises, and I have to do them every day of my life. It's not just something that stops here, because these exercises stabilize my spine. And I just have to make a lot of adjustments to my everyday life and put in the work and effort, and I'm ready to do that. After seeing the first x-ray, since being here, it was only like day 4? On day 4, and my curve had already gone down 5 degrees. So then Dr. Tony said the goal now was to see if we can get another 5 degrees down, and that would push me closer to moderate scoliosis, and I was able to achieve that. My starting curvature was at 41 degrees. Now it's at 31 degrees.
By reducing it 10 degrees, we literally brought her 20 years of time, right? I mean, it's just tremendous if you really think of that. And now with her home therapy and home rehab, we want to alter that progressive state. It's very minimal and it can have a tremendous effect on the longevity of her spine, so we're very excited about that.